In this week's Focus on Your Health, Teresa Snow explains a type of radiation treatment that works from inside the body to kill cancer.
Focus on Your Health is sponsored by MU Healthcare.
When colon cancer spreads, it most often goes to the liver. Today, there's an option to fight that cancer using millions of tiny radioactive beads. At least a couple of times a week, you'll find Mary Gladbach with her sisters, playing cards just minutes from the country home where they were raised.
Play cards, eat while we eat. We don't have anything, we don't have food.
Mary leaned on family through her first battle with cancer, but worried her time was limited when she was dealt a bad hand. Diagnosed again, this time with stage 4 colon cancer that had spread to her liver.
It was terrifying.
The tumors were inoperable, and in the liver, they were not responding to chemotherapy. At University of Missouri Healthcare's Ellis Fischel Cancer Center, a team of surgeons and oncologists looked at all the options. Dr. Ryan Davis, an interventional radiologist, suggested selective internal radiation therapy, or SIRT.
We can actually deliver up to 40 times the radiation dose to the tumor than you can with conventional external beam radiation, because we're delivering it almost from inside out.
Through a catheter, doctors deliver microscopic spheres filled with the radioactive isotope Y90. The beads are injected directly into the artery that feeds the liver tumor. That allows them to spare the healthy tissue.
It's a beta emitter, so it's a very high energy radiation that only penetrates the tissue for about a centimeter.
A year later, the bright spots on Mary's liver scans have disappeared, and though it's not a cure, it's meant more time for the things she loves most.
It's done its job, I guess.
Proving that even in her 80s, she still has a few cards up her sleeve. Joining me now is Dr. Ryan Davis, an interventional radiologist here at MU Healthcare. Tell me about that team that helps to decide this is the correct treatment for the patient.
So every patient that comes to Ellis Fischel Cancer Center gets discussed at a multidisciplinary conference. At that conference, there's surgical oncologists, radiation oncologists, and radiologists, and we all come together to determine the best treatment option for each patient.
Now, do you have to spend the night in the hospital to get this type of treatment?
No, it's an outpatient procedure. It does entail 2 outpatient procedures. The first one is sort of a practice run where we insert a catheter into the arteries that supply the liver, and we identify which ones then are supplying the tumor. And then we order the dose once we've determined where to inject the microspheres and perform it about a week later.
Do you use it on other types of cancer as well?
So the FDA approval is for metastatic colorectal cancer that can't be removed surgically and is not responding to chemotherapy. However, there's a large amount of published data that does support its use in other forms of cancer.
We're glad you're here. Thank you very much, Dr. Davis. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.